Welcome to Baby Magic. Today I have with me 4 lovely women from Embrace Refugee Birth that is based in the US. And we recorded about 6 weeks ago, but getting 4 women together and bringing them in from their homes, and with all of the outside variables that there are, kids in the background, phones, internet not working right. We had a lot of gremlins to deal with this time, so my sound man wanted me to apologize for the quality of the sound, but don't let that bother you. This is an amazing interview and such important work. Thank you for listening. Here we go. Embrace Refugee Birth tries to make birthing mothers' realities a little bit better. I'm happy to have 4 members of this amazing organization here today: Muzda, Muna, Heidi, and Aku. Welcome. First, I'd like to reach my hand out in love. I'm sure your community is still reeling from the shock of hearing about the murders of the 6 women last week in Atlanta. I know you're quite close to there geographically, and I know that the work that you do helps to build a better world, so thank you in love. I'd like you to please introduce yourselves for our listeners. Maybe Heidi, you could go first.
Sure, yeah. So my name is Heidi Copeland, and my role at Embrace Refugee Birth Support is the Program Impact Manager. So I can say a little bit first just to kind of introduce Embrace as well, if you'd like. But Embrace was started in 2010 and is part of a larger nonprofit outside of Atlanta in Clarkston, Georgia, called Friends of Refugees. And we have 6 different programs that serve just in different capacities in the refugee community. But Embrace Refugee Birth was started as a way to just help pregnant refugee moms better navigate the healthcare system in America, and just to walk alongside people throughout their pregnancy and birth and postpartum experience in the U.S. So, yeah.
Thank you. Who would like to go next?
I can go next. My name is Mujdan. I'm originally from Afghanistan. I have been here since 2014, and it's almost 6 years that I'm working with Embrace as a community liaison for Afghani community. And I have 3 kids, which are 3 of them is Embrace kids right now, yeah. And I have 6 years old my daughter, and almost 4 years old my son, and 26 days my younger daughter.
Oh, thank you so much for taking time out of your mother, your baby moon to speak with us. That's lovely.
Yeah, thank you. We are together. She's here with me. And say hi to everyone.
Muna?
Yes. Hi, my name is Muna and I'm from Burma. I started joining the Embrace in 2016 as a Korean contract interpreter, also the community liaison. I help with the I help with the mom with the filling of the paperwork, or if they need help with interpretation, that they will call me during their visit in doctor office. And also if they need help with to renew food stamp or Medicaid, yeah, I help all my karma with that. And I will happy to be part of the amazing program. Yeah.
Thank you. Aku?
Hi, my name is Aku. I am from Togo, and I started working at Embrace since 2017, and I started as an interpreter, and now I teach the healthy mom class to the African community. I have two girls, 5 years and 2 years old. Thank you.
It's wonderful to hear all of you very busy mothers, busy helping other mothers and busy making a better world. Just a question, how many families has Embrace assisted this year?
Our numbers in 2020 were we served 79 moms. We regret that, because of the pandemic, we weren't able to do education or classes or birth support for quite as many as we have in the past. So a lot of our support was a little bit more hands off of just making sure people had what they need and had the information that they need kind of from afar. But yeah, we were able to serve 50 moms through our Healthy Moms classes that Aku mentioned online, virtually. And then, and then the other moms that came through our program, we were able to help support them by, having, bringing them car seats or, helping them with different paperwork or, providing rides to their doctor's appointments, that kind of thing. So, yeah.
So do you provide virtual doula support as well?
We have not been able to. It's just a little bit too tricky with our the language barriers and the kind of technological barriers that we face.
Yeah.
So our classes are taught by our community liaisons, which Mujda and Muna and Aku are a few of them, and they're taught in the languages of the moms that we serve. But most of our labor support is offered by volunteers who are American volunteers, and so just virtual support would be a little bit tricky with the moms that we work with. So, yeah.
And as it is in where you are, the mothers are they're not allowed to bring in a doula in the hospital?
So the current protocols at our local hospital are that you are allowed to have one visitor the entire time that you're in the hospital. And so for a lot of our families that we work with, they preferred to have a partner or a family member with them, which is the reason why we didn't offer as much labor support. But some of the families didn't have that kind of support, and so we were able to offer them the labor support, birth support. Yeah.
Okay.
So, yeah.
So what are some ways that that Embrace creates a more positive and joyful experience for the families during the childbearing year? Especially during COVID, I imagine that must be such a challenge.
Yeah. Mujda, would you want to answer that? I know you had a lot of really good success in kind of offering some good peer support, group support to the moms that you work with last year when the pandemic first started.
Mm-hmm. Yes. We all did. Actually, I made a group, my messenger, as most of the women in our community using the internet, Wi-Fi at home, and they have like social media. I made a group of a messenger and add all of the moms that we were able to work with them before the pandemic, and also the pregnant mom who got pregnant during the COVID. I add all of them, and usually like in 2 days we call them. Every 2 days we called and we share everything with each other, and I ask them questions, and also I was there to help them or give them more information about COVID whenever we got from the CDC and other resources. I share with them, And usually it was really helpful for my community because the moms, they knew each other through that messenger, and they got contact with each other, and it was helpful for them that they didn't get bored, and they shared their problems and they talk with each other. um, I think it was a good opportunity for them.
I think it's so important that you're providing that service, because I know that from working with, I ran an organization here in Montreal for 13 years. We worked with refugee and no status families, and I know that one of the big problems is isolation. So especially during COVID, to provide that group and to call every 2 days, that's amazing. That's I'm really I'm really very much in awe of you. It's a wonderful offering to make.
Yeah, and also they had more communication with each other. Sometimes I wasn't able to join them, but they all call each other and talk with each other. Sometimes I see that they call in the group messenger and talk. Sorry, but I wasn't able. But when I had time, I joined them, and whenever they have questions, they let me know, and I was able to uh, get their question and ask from someone that they knew, or if I knew the answer, I was help them that time.
So the next question that I was wondering was, what are some of the ways that Embrace has made your own lives better? Because I think we give and give, and we always have to respect that the giving also increases our own pleasure and joy in our lives. So for all four of you, what ways has being a part of this organization made your own lives better?
I will go first with the answer. If others want to add something, they can. When I came here, I didn't know anybody. When I came to the USA, even there was a lot of Afghani family, but I wasn't in touch with them and I wasn't connected with them, and I feel very alone. And I was pregnant that time, and Embrace, the only place was that helped me, and I knew Heidi from the first month that I came to the USA. After that, when I joined with Embrace, it was my dream that I can continue my education or do something for the community, for the women, like be advocate for them. And Embrace helped me, and they encouraged me, and they gave me that self-confidence that I can do something. And when I joined them, I started working as an interpreter. By the day, we joined for few certification program, and still we are doing our certification for the childhood education. And nowadays we start teaching mom the healthy classes, healthy birth classes for the mom, and it really makes difference for my life. Now I have big dreams. I'm just dreaming like the big goals that I can reach. Now I have that self-confidence that yeah, there is a support, and if I ask help, they are ready to help me, and I can reach to my goals in my life.
Thank you. Heidi?
Yeah. So, Embrace has made a huge impact on my life. I went to school for social work originally. I got my bachelor's degree in social work, and knew that I wanted to work with women in some way. I just had always been passionate about women being empowered and supported, and was interested in pregnancy and birth, but didn't really know anything about it at the time. But there was kind of this also this hesitancy of I didn't really want to do social work in the way that I was really being like taught in my classes how to do social work. I felt like so many of the outlets for working as a social worker were very just kind of hands off and kind of created more barriers between people than connections with people. And that, I know that's not true across the board, but so many of the kind of examples that I was seeing were like that. And I just was more interested in doing something relational where I could really connect with people and have mutual relationships with people that created, just mutual support for each other. And I moved to Clarkston soon after I graduated college, and just fell in love with the community, and the community really welcomed me. I had neighbors from all over the world who would, invite me into their home and make me feel like I was part of their family. And yeah, just this community has taught me so much about love and about welcome, about supporting each other, and Embrace has really been a huge part of that. And then just the aspect of being able to be a witness to women's strength and power as they bring new life into the world. It's such a huge blessing. And I know that you know that, Rivka, from all your work as well, but it's just, it's just one of the best blessings to get to be a part in some way of that, and to be welcomed into that holy space, and to be, to be a witness to women's power and strength and that beauty.
Yeah, it's such an honor.
Mm-hmm.
Well, thank you. Aku?
Yeah, in fact, I was a midwife back home, and one of my responsibility was to, educate women on pregnancy and birth. What I was really interested in, and when I came here in 2015, it was like I was disconnected from my job. But and then I found Embrace, and with Embrace, the job, the work I have been doing at Embrace helped me a lot to stay updated. You know, when you are not, I was not working anymore, and for me, at some point, I started to forget a lot of things, but being with Embrace, helped me to stay updated. And also the fact to be in the life of women, to help them, to educate them on pregnancy, and at the end, for the fact that the women get the best outcome. It's for me, it's like a huge blessing. Whenever the mom calls you and say, oh, or the mom tell you about his story, or let you know that, oh, you helped me a lot, that's because of Embrace, because of your help. That's a huge blessing for me. And also, Embrace is helping me now to continue my education. Right now, we have been working to become a childbirth educator, which is huge blessing to me. And I'm pretty sure that after that, um, I'll get more help to continue my education, and why not one day to become a midwife in the United States.
Yes, why not? Wonderful. Thank you. Muna?
Yes. Before I did not know about the Embrace program at all. I know I start knew that the program it will like I came here in 2007, and I only know in 2016 that Embrace this kind of program existed. Before I didn't know, and during that time I study in college and study social work. After I start working with Embrace, I feel like I grew more closer to my community, especially the women in my community. And I knew that because I attended a lot of births. And for the experience that I attended birth, it also helped me like ready. Also helped me when I gave birth with my baby. It's also because I already know, I already see the experience what other women had to go through, and it's all helped me prepare for my first pregnancy. And I think that's the benefit of it, and I'm also blessed to be part of this program. And yeah.
Thank you. So I just want to give listeners a sense of what kinds of services you provide for families. I think you mentioned some of them, so childbirth education and helping them navigate, bureaucracy and things like that, possible birth support. What else do you provide?
Yeah, so we kind of have two main parts to our program. We have our education, our classes that we, our founder, Jenny Cochran, who just recently, about a year ago, stepped down from being the director at Embrace. She created a curriculum called Healthy Moms Curriculum, and it's a 8-week class series that she just created it to be very culturally sensitive, very image-based curriculum, very simple, as well as very like peer support. And Mijda, Muna, and Aku can probably speak to that a little bit more. But the other side of our program is our kind of more like one-on-one support. And we have volunteers that I mentioned before who we pair with women so that they can build that relationship with them and help them go to their doctor's appointments. They provide transportation as well as advocacy. A lot of the doctor's offices that we go to either don't provide interpretation or even if they do, there's just, it's just great to have somebody with you as an advocate to be able to see when something is missing, when when the mom may not understand or may not, feel like she has the space to ask a question or things like that. And so the volunteer is there to kind of just, observe the mom and what she's experiencing and help her to find her voice in that space, to be able to ask questions and understand what's going on throughout her pregnancy and birth experience. And then that volunteer is on call to provide labor support, and they go with the mom to the hospital and walk through that whole process with them. It is, I have to tell, doulas in training or doulas who are already kind of established that it's a little bit of a different experience providing labor support for our moms, because it's quite heavy in the advocacy area, that just again, it's you're kind of the observer to watch out for when something is missed by the medical care system, and not for necessarily any fault of the systems, but or maybe it is the system's fault, but not necessarily the provider's fault always, but just kind of caught in this system where it's very tailored to white English speaking women. And so just kind of having that volunteer to observe and watch out for where there might be discrepancies and where there might be discrimination in care. And so so that volunteer support is very heavy in the advocacy arena. And then that volunteer goes on to support the mom postpartum. And again, it is the emotional support that a postpartum doula would provide, the education side. But again, there's some other pieces to it that an American or an English speaking mom, may not experience, like needing help with paperwork or needing help to get family planning before her Medicaid ends or things like that. So just a lot of kind of smaller details, but those are the kinds of things that the volunteer can try to watch out for. So do you guys have anything else that you would add to what other services or support we provide?
Yeah, I think Heidi, you cover most of the stuff that we help with the mom. Like Heidi said, we not only help you like some the women from a community, like even though they already have their baby, we like for me, I still help them like every day. That if they need help, we like it doesn't have to be related to pregnancy or birth, like anything, like if they need help, like the kid to enroll in school, like I also help with that. Or also they need to like other paperwork that they need help to fill out, and always available to help them. Yeah.
So I have a couple of other questions. So many of your stories are seeming like they're taking me back to our organization, Montreal Birth Companions, that we had for many years. I think one of the differences is possibly because here in Canada we have a national health insurance system, but the people that we were serving, if they were registered refugees, then they would have the health insurance. But if they were not, if they were refugee claimants that had been refused, if they had been told, like if they were being deported and they were living, underground, so to speak, or if they were otherwise not covered or non-status, then they wouldn't have insurance. So it was even more important for us to support them through an experience that wouldn't cost so much. And obviously, so we had to provide the kind of care that would help them have more natural births, just because, the more interventions, the more expensive it is. But also, I really hear you, Heidi, when you were talking about like the regular doulas in training or doulas. I actually provided training for the women that wanted to provide support for these families, because it's just so different. Like it's so different. Like you might have a private doula client that comes in wanting her, best birth experience, which is wonderful and empowering and everything. But many of our people that came to us really didn't care about like how they would feel. They just wanted to have the baby and somehow, manage to stay in Canada. So a lot of it indeed was, documents and navigating and just getting food and getting a place to live. And Montreal is, people that come here in the winter from a warm country are really, they don't know how cold it can get. It's ridiculous. You can't even go outside your front door without feeling like you're going to freeze. So, but I think even so, I think a lot of our issues were the same. But just to clarify, so the people that you're serving, well, do they pay for their medical care?
Um, so I'll clarify a little bit of that. So, in the U.S., there is kind of like a, federal, like Medicaid, is what it's called, that like every state has access to funds to receive this kind of, public medical insurance. However, every state is different in what they accept and their laws around it. And so I'm not, as educated or aware of what other states do, in regards to Medicaid. I know that some of them are provide more services and Medicaid for more folks than Georgia does. Georgia is pretty limited. And so in Georgia, what we experience is that if you are legally a refugee, if you have refugee status, you can receive Medicaid when you first come to the U.S. for about 8 months. And then other folks on Mujda and Muna and Aku, you guys can correct me if I make any mistakes, because I know it also changes all the time, some of these laws. But yeah, so my understanding is that this is still the case where a newly arrived refugee can have Medicaid for up to 8 months. Children who are refugees can have it until they're 18. But then it gets cut off after 8 months for all adults. And for pregnant refugees, folks who are pregnant who have refugee status, they qualify for pregnancy Medicaid. In Georgia, it's called Right from the Start Medicaid. I don't know if it's called something different in other states, but and any U.S. citizens can qualify for that, if they're within an income level. However, anyone outside of that, like you mentioned, in Montreal, very similarly, but even folks who have legal status here in the U.S. do not qualify for it. So Mujda and Aku, actually, on this call, they came under a different status than refugee status. And we have a handful of moms who come to us to be served, who come not with refugee status, but asylee status or some other kind of work visa or school visa or something like that. We haven't had very many folks come to us over the years who don't have legal status, but I think that's mostly because of the area that we serve. I think there's just not as many undocumented folks in our area that we serve, but there are certainly several in Georgia, and so it's just not the area that we're in. But but those folks, we definitely have had to learn how to figure out ways to help them navigate. So there's like a public hospital downtown who provides more discounted services. It's called Grady Hospital. And so most of the moms who don't qualify for Medicaid, we refer them there. And they still do have to pay, some out-of-pocket costs, but kind of like similar to what you're saying, we try to help them navigate that to where they don't have to pay as much. But yeah, I don't know, Mujda or Muna or Aku, do you guys have any other things to add about how that part of our system works?
For me, when I was pregnant with Anna, I was qualified for pregnancy Medicaid, so I don't have to pay anything. Like for example, if you have a primary insurance and then the pregnancy Medicaid, that will be a little bit more like complicated. Like you will have to like always have to call your primary Medicaid. Also, you have to call the pregnancy Medicaid. Like they all these two your primary Medicaid and the pregnancy Medicaid. They always have to work together. Like because you don't want to pay the like all the hospital fee or anything. They usually for example, if your primary Medicaid is not cover, like they don't cover the expense, then the pregnancy Medicaid we had to cover everything.
So it sounds pretty complicated, and you would definitely have to help people through the bureaucracy.
Yeah, you had to call, and then you always have to make a call. Yeah.
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 So I guess kind of on that note, do you ever find it hard to make boundaries between some of the women that you're serving and yourself? Like, do you feel like, is there ever a point where you feel like someone's taking up too much of your time and maybe you're not spending enough time just on yourself and your family? Or do you find that because of the way that Embrace is structured, it's pretty easy to navigate for yourselves? How do you do that? How do you keep a balance?
For me, I don't have a lot of mom. But you before before the pandemic, I have a lot of mom. But after the pandemic, no, like I don't have problem with my mom. Like they always they call me. They usually only call me when they need me. Like if they don't need me, they don't usually call. But I always call them and make sure they're okay with the like doctor appointment or like everything that they need. Like for me, I don't have any problem.
Aku, did you?
Yes, I just want to talk. For my side, I teach the class in different language than the mom speak. So I speak. I teach the class in French, and there's an interpreter who translate the class in the mom's language, and the mom's language are Swahili, Kinyarwanda, and there are few moms who speak French. So yeah, I don't have any problem with those moms, and whenever they have questions, I'm even more happy to help them. So I don't have any problem with them with calling me or texting me or whatever. I don't have any issue.
You're very generous.
Okay.
Gustav?
Yes, I want to add a few more things. In my community, beside all the supports that we are doing through the Embrace, most of the time they call me, whatever help they need. It's not only for the pregnant mom. Still, I'm in touch with the mom that they delivered their baby in 2016. But still, I'm in touch with them. They are connected with me. They sometimes call me for any problem they have, like a social problem, or they have any other family problem. It's like something that make me very happy that they trust me. They still remember me, and whenever they have any problem, they just thinking about me, that they can reach me and they can share their problem with me in any ways that I will try to find a way to help them with to solve their problem. Sometimes if I wasn't able to do something for them, or I wasn't able to give my time for them, I always ask Heidi or someone else from Embrace. There is someone all the time. whenever I am not able to do something for those moms that they need really help, Heidi or any other Embrace staff, they are ready to help with them. That's the reason that I never feel pushed or overwhelmed with my job, with my work, and it's something that we are enjoying, like as a family. Even I don't have time or I cannot give my time for them, I can just ask someone else from the family to help them, and it's something that really works, and they trust everybody, and it helps. That's the reason that we don't feel pushing in our work and overwhelmed.
It's wonderful that you've been able to create a community that allows for that, so that you can give as much as you can give, and then when you need to give it over to someone else, you can do that with trust.
Mm-hmm. Yes.
Yeah, I feel really thankful to hear you guys say all of those things. I definitely think that our community liaisons, certainly get the brunt of all the it's not necessarily like the word problem was used a few times, and it's not like people are trying to cause any problems, but we hear a lot of hard stories, and we experience a lot of hard things, and so the community liaisons are kind of that first, they're the first people that are hearing about those things, and so they do carry a lot of weight, and so we have really worked hard to create an environment and Embrace where we can support each other in that, and we have a really wonderful volunteer network who I'm able to call on, like Mujda said, when the community liaisons are not able to do something right away, and I'm able to reach out to our volunteers and get folks to jump in to support. We certainly have hard days and days that we don't have anyone available, and that's probably the hardest thing is when someone does end up alone at the hospital giving birth, or experiencing something else that's difficult, and we're not able to be there for them, but overall, we really do try to create that environment of supporting each other on our team or in our family, as Mishta said, as well as creating that space for the women that we serve. So yeah, I was able to do a training recently, and now I'm blanking on her name. I should look it up so that I can give her credit, but it's on pregnancy loss. And her kind of like, she has this kind of model of care where she, and now I'm blanking on even the wording. It's like you support in, so like the mom is kind of at the center of the work, and then you dump out. And I think for us, and it's kind of these concentric circles, for us, I think it's like that embraces kind of that next circle out where we can dump out to each other if we need to, but that we're able to focus all of our support in on the mom. The woman's name is Amy Wright Glenn, who offers these trainings. But yeah, so I really love that model, and I think that's been our goal at Embrace, is to kind of create that space where we can dump out to each other and be able to give all that we can to the mom who's in the inner circle.
That's so important. So all of you, I'm going to ask you a difficult question now. Just take a second. But what has each of you? What has been your greatest challenge, moment of challenge at Embrace?
I will go ahead. The big challenge that I had with Embrace sometimes at the beginning of my job, that I wasn't able to drive, and I didn't have my driving license, and I wasn't able to help as much as I'm doing right now for the moms. And that was something that sometimes whenever I wanted to reach immediately for them, I wasn't able. And that was the big challenge. But by the time I got my license, and I'm able to do it. And for the nowadays, the big challenge is the COVID. It's something that it keep us away from the mom, being in person with them. Um, I think this is what I think.
Uzda, you sound like such a powerful woman. Would you mind if sharing what are your dreams for your future?
I really want to continue my job for being advocating for the moms, especially for the new mom that they are coming from another, from the a country that always they are thinking about, they're risking their life, and always they're just wish for the peace to live or sleep in a peace moments, but they don't have, and they don't think anything else. And I'm really enjoying working with them, and this is my goal, to advocate for them and continue this. And beside that, I want to educate myself more, that I should be able to help them in any ways that they need. And as Aku said, I want to continue my education, and it's my goal and it's my hope that one day I will be a midwife, that they can trust me more, and I can be able to help them more, whatever they need during pregnancy or during the labor.
Well, I wish you all the best on that hope. I think you will make a wonderful midwife, and Aku as well. I hope you both get there. Muna, what are your dreams for your future?
Muna, I don't know if you're muted or not.
Oh, yeah,
Okay.
sorry. I was talking about myself.
Okay.
Yes, for me, I want to continue working with my community, especially the women. I want to advocate for them in every way, everything, like whatever they need. Like not only for the not only during their pregnancy, or also after the pregnancy. Like if they need help with social help or every day that they need. Yeah, I would like to continue to do that.
Thank you. So if someone in a different city or even a different country wanted to start a community like yours, what kind of advice would you give them?
I will tell them that first, to make the relationship, or just learn more about all the culture. It's really important that if they want to make a trust between the community and yourself, they need to learn more about all the cultures, and also the respect. They should learn how to respect, because I know respect is different in every culture. The way that they feel respect is different. As I work with Embrace, and we work with so many cultures, and we learn that respect is, in their idea, is it's really different way they feel respect. I really want them to learn more about all the cultures that they want to start working with them. It's really important to make the trust.
Trust and respect. So start with the foundation of trust and respect. Aku or Muna, Heidi, do you have things to add? How do we create something from nothing in a different city or a different country?
I think Mujda really, said it really well. And I think that kind of in addition to that, and it kind of answers your questions about challenges as well, that I think we had a lot more challenges before we had met our community liaisons. We we just really struggled to like know the best ways to educate or the best ways to come alongside the women in the community. And the way that we found our community liaisons was that all of them were already leading in some capacity in their community. And so we were able to find these leaders who people trusted, who were already doing the work that they're doing at Embrace, but we were able to, kind of empower them and support them to do it more and to do it with pregnant moms. And so that was definitely a key part of it, was just, being able to build relationships with these, wonderful leaders who are already helping and serving in their community.
That's so interesting, because basically, like you said, Mujda, respect and trust, and then to go in with humility and actually seek out in an organic way the leaders that are already there. So you're actually building a grassroots community from the bottom, from a place of trust and a place of trusting that the people that are already in the community know what they're doing.
Yeah, and I think that that speaks well to it too, because we knew we weren't trying to like fix birth or something in these communities. We knew that these women were coming from long, histories of knowing how to give birth and having circles of women who taught them and helped them. And so we wanted to draw that out. We knew that they're coming to the US, that there was the possibility of those beautiful histories being squashed and being kind of almost taken away from them here by the system that we have. And so we wanted to give them the space to be able to share their stories and share their knowledge and experience and help each other to have those same experiences, or to be able to access their own cultural values and beliefs around birth. And so it was very important to us that we found, people like Aku who were birth workers in their community already. And we had a couple midwives when we first started who came on to help us interpret and teach. And that was kind of like the first our first entryway to this goal of being able to empower these women, was just being able to help welcome them here by creating a space where they could be themselves and access their what they already valued about birth in their cultures. So yeah.
So I have just a couple more questions. Just a really practical question. The course that you mentioned, is that available for others, for other organizations to use?
That's a great question. We have been hoping to make it accessible, and we're not quite there yet. But I would certainly say if people are interested to reach out, and we are hopeful that in the next couple of years we can have that more accessible and available. It is very close to that place, but just not quite there yet. So yeah.
Okay, good to know, because that sounds like a really, really important resource.
Yeah.
So the next two questions I have, one is, I would like all four of you to think of a word that you would like to give out to our listeners. One word that they can hold that is meaningful in terms of the life of the birthing mother. One of the mothers you work with, the mothers you work with, or the work that you do. What is your word?
For me, it's empower. Like we want to empower the woman, like to know, be able to decide what's good for them.
Wonderful, thank you.
Yeah, I can say that we give them to feel support all the time. Whenever any decision that they want to make during the labor, they feel support, that there is support for them, that they can feel support for any decision that they want to make for their self and for their baby.
Thank you. Aku?
Yeah, I just want to say that we are ready to advocate for them and also to empower them.
We have three wonderful words: empower, support, advocate. Heidi, what's your word?
This is a hard question. I don't know why. It's just there's so many words that
Yeah,
come to mind.
I know.
I think the one that just keeps resonating with me today is sacred. Just that, yeah, and I think it kind of culminates from this place where if a woman feels empowered and supported and advocated for, that her birth and that space can be sacred. So, yeah.
Thank you so much. So my last question, I would just like all four of you just to speak up and really just give us all a list of the countries that that some of the families that you have supported, where everyone comes from, just all of the countries that you've encountered through your years of work with Embrace.
Yeah, I can say from Afghanistan, Iran, Pakistan. Those are the countries that I had moms mostly from these countries.
I would say Burma, Thailand.
Aku, you must have many.
Most of the moms are from Congo, and I think I had a few moms from Central Africa Republic. Heidi, can you help me?
Sure. Yeah. Yeah, we've had a lot from Africa and the Middle East and Southeast Asia, but definitely from Congo and Rwanda, Burundi, Tanzania, Kenya, and then more north, Sudan and Central African Republic, Sierra Leone on the west side. Some that are closer. I think we've even had some from Togo too, right? Aku, I think
Yeah,
we've got one or two.
Yeah, and
Ivory Coast.
Yes.
Yes, yeah. And also from Egypt and Ethiopia, Eritrea. I think those are most of the African countries that we've served. But yeah, like Mujda said, from the Middle East, we've had Syria and Afghanistan, Jordan, Iran, Iraq.
Pakistan.
That's mostly Pakistan, yes, yeah. And then we've had folks from Bangladesh and Burma and Thailand, Nepal, Indonesia, Malaysia. Yeah, I think that's all that I can think of off the top of my head.
It sounds like you're serving the sisters of the people that we used to serve. So thank you all so much for sharing this hour. And Aku and Musta, I'm looking forward to hearing about your midwifery training. If there's any way I can help, I am totally here for you. I know it won't happen right now, Musta. You have a young little one.
Yeah, thank you so much. Just pray for us.
Yes, thank you so much, Rivka. We've really enjoyed having this conversation today.